I'm a diabetic and have been for years. And my diabetes was up to, the AC1 was up to 10. At one point, it was actually 11.
I was diagnosed with diabetes when I went into the hospital. I started with a small wound on the bottom of my left foot. And it slowly was, what I didn't realize is that even though the surface didn't look that bad, there was an infection lurking underneath. And so in February of this year, that little wound had almost completely closed up, but that infection that was brewing underneath had tunneled to a different part of my foot and opened up.
The biggest help from my mom, she's a diabetic and she has neuropathy in her feet. I mean, bad neuropathy. She'd have to take, medications every day for it. And sometimes I might hear in the middle of the night screaming, with pain, just a shot of pain will hit her foot.
It's tough to look at a chart that lists you as morbidly obese. And they informed me I had type 2 diabetes. I required 4 shots of insulin per day.
Everything was in the normal range except for my diabetes, but it had dropped by 2 points, which is huge. Because come to find out, I have a form of type 1 diabetes and not type 2. So it was huge that it had dropped down by 2 points.
The first thing I did when I found that I was going in the hospital is I told my husband, bring my patches up here because I'm going to need them to get me through this. There's no way I'm not patching through this situation. And even from just a couple of days in, the doctors were saying how impressed they were and amazed that they were how good the wound looked after even just 48 hours.
Sometimes I might hear in the middle of the night screaming, with pain, just a shot of pain will hit her foot. That has been completely eliminated with the X39.
Today, 8 months later, I no longer have or take 8 subscriptions for my heart. I no longer require any insulin at all per day. My primary physician last month, April, said to me, and I quote, "Stephen, you are no longer a type 2 diabetic and your lab results are incredibly outstanding."
My pain level was down by about 80%, and my mobility in my legs, which was huge, was up about 50% at that point. I remember thinking, you have got to be kidding me. This little bitty Band-Aid did not do that. And of course, I started watching all the videos and started learning everything I could about it. And I haven't stopped yet. Every chance I get, I'm learning something. But there was so many other things that started happening. I'm a diabetic and have been for years. My doctor and I have been working on my blood work for, I don't know, 5, 6, 7, 8 years. And we could not get my thyroid back into normal range. My cholesterol was out of whack. And my diabetes was up to, the AC1 was up to 10. At one point, it was actually 11. And no matter what I did, nothing seemed to help on it. So after being on these patches for 6 months, I wanted to go get my blood work done. When I went to get it read by the doctor, she walked in and she was absolutely blown away. She said she was so proud of the improvements that I had done. Everything was in the normal range except for my diabetes, but it had dropped by 2 points, which is huge. Because come to find out, I have a form of type 1 diabetes and not type 2. So it was huge that it had dropped down by 2 points. I've had so many things that just as I go along through month by month, things are changing. My hair started changing colors. I started getting darker. And I have arthritis in my hands, especially my thumbs. I no longer take the glucosamine for them, and I probably should take it, but I wanted to see what the patches would do for it without being on glucosamine. And now, 7 months later, I very seldom have any kind of problems with my thumbs at all. no pain. Once in a while, I'll get a twinge, but that's about it. Scars that were surgical scars from 50, 55 years ago have flattened out. My skin is so soft. I have people tell me all the time how great my skin is. That didn't happen before the patches. I had sores on my arms periodically. And I never really thought much about it. I thought maybe it's old age. Your skin gets thin and you start bruising real easy. And I had a really bad one that was on my arm. And it started going away and disappearing in about 3 days. And that was unusual. It would normally take about 2 weeks for them to go away. And I never really attributed that to the diabetes, but I think it is. I think it's the diabetes. And now I can carry grocery bags, and very seldom do I get a bruise on my arm from it. So I'm like the lady before, I can't stop talking about it.
So last summer sometime, I started with a small wound on the bottom of my left foot. And it slowly was, what I didn't realize is that even though the surface didn't look that bad, there was an infection lurking underneath. And I also didn't realize at the time that I had some significant nerve damage, so I wasn't feeling what was going on there. And so in February of this year, that little wound had almost completely closed up, but that infection that was brewing underneath had tunneled to a different part of my foot and opened up. And so on February 6th of this year, I landed in the emergency room and was admitted to the hospital with what you see. This is actually a while later, actually. This is actually a month and a half after I got all this started happening. So on the next morning, on February 7th, they started the first of 3 surgeries, and to basically go in and take out all the infected tissue. And when they finished that first surgery, the wound on the bottom of my foot was about 9 centimeters by 8 centimeters, which is roughly almost 4 inches by 3 inches. It took up most of the bottom half of my foot. And so the 3 surgeries while I was in the hospital, I was there for a little over 2 weeks. And they were looking at, the first thing I did when I found that I was going in the hospital is I told my husband, bring my patches up here because I'm going to need them to get me through this. There's no way I'm not patching through this situation. And even from just a couple of days in, the doctors were saying how impressed they were and amazed that they were how good the wound looked after even just 48 hours. They were expecting infection in the bone. The MRI had showed a couple of spots where they were pretty sure there was infection, and there was not, thankfully. That would have completely changed the course of treatment and how long that would have taken. Because of the location of this being on the bottom of the foot and it being as large as it was and as deep as it was actually 3 centimeters at its deepest point at the beginning, which is over an inch deep at one point. So the third of the surgeries was a skin graft, but because of the location, the depth and the size of it, they said it usually takes about 6 to 12 months for this to heal. And but what like I said, they told me it would take 6 months to a year, and this here I am just over not even 4 months, and it's completely closed now. While you're looking at that, I just want to share a couple of comments, from my doctors. The first one, this was 2 days ago. The wound's completely closed. There's just a few spots there where the skin is still a little bit thin and it's still toughening up, but the wound is closed. And so yeah, they said it's under 4 months. And one of my doctors, the podiatrist, said, I wish all my patients' wounds looked this good. He said, this is amazing how quickly this thing has healed. And 4 months may sound like a long time, but in light of the fact that these types of things usually take 3 to 4 times that, or 2 to 3 times that, it's actually healed very quickly.
And so in the time that you were down,
Mhm.
I think you also dealt with some isolation.
Mhm.
Tell us just briefly how you feel like the patches helped you along the way, where dealing with isolation, you're dealing with pain, you're dealing with wondering if you're going to walk again because it was such a real and true deep wound.
Mhm.
Tell us a little bit about that and how you feel like it really helped you move through it to where you are today.
So yeah, the doctors, you know, when you go in, they always, especially it's before their surgery, they're going to tell you worst case scenario. And there was the possibility from the beginning of me possibly losing my foot. And I just said, I stopped him right there. I said, no, we're not. That's off the table. We're not doing that. But yeah, so during these last few months, I've been home, just recouping, and of course, obviously been off my feet because of it's on the bottom, so I haven't been able to put any weight on it. So I've been using a knee scooter to get around the house, and a lot of isolation, a lot of just time alone. There was some depression that I was battling during this time. And one of the things that I've learned about myself during this time is that when our bodies are, when you're facing a physical issue, some kind of a sickness or injury or illness, it affects your emotions and it affects your mental clarity and it affects your spiritual condition, and it affects the whole person. And as what I've noticed over the last couple of weeks, as this healing process has come to a close for this part of the recovery, that I can tell that my body is now shifting to the stem cells that were focused on healing that wound are now free to go other places in my body. I have no idea what they're doing. They're not giving me a map to what's going on. But I would like to point out that give them some pointers, but they know better than I do. But I can feel it in my spirit. I can feel it in my emotions. I can feel it in just my mental state. And I feel like I've got my joy back. I feel like I've got my focus back. I feel like I'm getting me back, honestly, for the first time in a very long time. I was very sick for a while before leading up to this and didn't really know it. I was diagnosed with diabetes when I went into the hospital. I did not know I was diabetic. Actually, I've been in denial for a while, honestly, and had my statement was always when people would ask, well, I haven't been diagnosed with diabetes, mostly because I hadn't been tested, because I stay away from doctor's offices. I don't want to go.
Right. And one thing we know that we don't diagnose, treat any kind of specific condition. I know that there could be some glucose or sugar issues in the body.
Exactly.
So I appreciate you sharing the situation. Someone did ask, so I just want to, so you had this wound, you didn't really know it, and it festered and rose up because your body went to
yes. Well, on the surface, it looked like it was almost completely healed up, but underneath, it was other things were happening. I couldn't see it and I couldn't feel it. Yeah.
So what you had shared with me privately was that you really feel like the patches had gone after something really critical on this side of you that could have shown up way later. And given the information glucose issues, it's wonderful that we were able to catch this before it turned into something where it could affect a limb.
Catastrophic. Yeah.
Thank you so much for sharing. You're just such a spiritual.
The biggest help from my mom, she's a diabetic and she has neuropathy in her feet. I mean, bad neuropathy. She'd have to take, medications every day for it. And sometimes I might hear in the middle of the night screaming, with pain, just a shot of pain will hit her foot. That has been completely eliminated with the X39. And that's the only thing she's used is just the X39. So that is the biggest thing. But I think it's funny because what she thinks or what she sees is the biggest benefit is that her beautiful white hair, the roots are coming in black. And it's amazing. I took a picture of it, and honest to God, if anybody wants to see a picture, text me and let me know. I'll send it to you. Her roots are coming in black, and her hair when she was younger was black like Peter's. But I think she's got beautiful white hair. But anyway, that's her big deal, is her hair. But the pain, of course, is pretty awesome.
I just want to review and make sure that people heard. Her mother is 90 years old. She was going to be out. She was going to be on this call tonight with us, but she's off driving her car, visiting with her friends, and not planning on coming back for a while. So Check that out. That's
Yeah.
awesome.
It's tough to look at a chart that lists you as morbidly obese. And they informed me I had type 2 diabetes. I required 4 shots of insulin per day, 8 prescriptions related to heart per day. When I came home, I realized that I had one of 2 choices. I could either put my house in order or I could change my ways. And I chose to do the latter. I gave up salt, sugar, processed foods, but I needed more. I needed more help. And then Eric Beal, a friend of mine for 30 years, kept calling me, and finally I returned his call. And Eric's first question was, "Are you okay? I've got a feeling somehow that I needed to call you." Well, I told Eric about my issues, and then he told me about Lifewave. And he asked me to go to startx39now.com. And I looked at x39now.com, startx39now.com. I looked at all of the videos, all of the information. I told Eric, I'm all in. And I joined Lifewave, got the patches, and started on my journey. Okay. Today, 8 months later, I no longer have or take 8 subscriptions for my heart. I no longer require any insulin at all per day. My primary physician last month, April, said to me, and I quote, "Stephen, you are no longer a type 2 diabetic, and your lab results are incredibly outstanding."
Wow.
My cardiologist said to me, "Stephen," I quote, "you are no longer, you have a Superman heart. We cannot find any signs with all of the tests we put you through that you ever had a heart issue. The product line is unbelievably amazing." I will tell you there are other things, and I tell Eric when I talk to him, I said, and it also has some interesting side effects. My hair has gotten much thicker. My hair has gone from white to gray, and it's starting to go darker. I don't need cheaters anymore. I used to need cheaters. I don't need cheaters anymore for fine print. I can read. And of course, those wonderful age spots have absolutely disappeared off of my arms and every place else. And I'm trying to be brief here because it's done so many things for me. And I have enjoyed sharing it with anybody and everybody I know. I consider it to be really, because of the results, I believe it to be my responsibility, my moral, absolute responsibility to share it with everyone that I know. Okay. I can't guarantee everybody will immediately see what I saw, but I know that I have fulfilled my obligation to let them know that this fabulous technology exists and that, yes, you can reactivate your stem cells. You can not only stop, but you can reverse the aging process. I am a living, walking, talking example of what can happen.